Good morning. It is our media briefing on June 3rd. Bob Ravenscroft, the Vice President for Advancement. I have John here today. We did not receive any advanced questions before today's briefing, but as usual, John and I are here and we'll do our best to answer any that you might have. Before starting, we're going to ask your help on one other thing. If you can work it in, great. Obviously, there's been a lot of gatherings. Youth sports are starting their training. Businesses are opening back up. So we're going to ask you to help remind people of symptoms to look out for. For all of those, there's masking, meticulously washing our hands, distancing. But as we've gotten further into this, we want people just to reground themselves in the symptoms they can identify themselves. They're also the things that you need to be able to adequately answer before you're allowed to be one of the visitors or a support person in our facility. So just real quickly, here are the symptoms that once you go from being an asymptomatic carrier to more active with the disease process, it's fevers or chills, cough, shortness of breath, difficulty breathing, fatigue, muscle aches, body aches, headache, loss of taste or smell, new loss or taste of smell, sore throat, congestion, and then there's been some new ones that have been added from when we first started reporting on this back in March. Nausea, vomiting, or diarrhea can also be symptoms. So if you exhibit any of those, please check with your physician and get to one of the testing sites in the community. I think what I would also like to say is it's okay to frequently temperature check yourself. Many people at Bryan, not just the clinical folks, but the support folks will do, a morning and an evening temperature check just to stay on top of things too. But again, as we've had people out and about gathering, things starting up again, it's just really important for people to be able to recognize these symptoms early on and seek the care that is needed. Real quickly with the stats before John turns it over and we open it up to questions, we had 437 as our midnight census. We have now administered 9,894 COVID-19 tests through Bryan. 1,323 positive results now, and we have 457 results that are still pending. So with that, John, I'll tell you what's going on in the medical center, and we'll answer some questions. Thanks.
Thanks, Bob. And as we've shared with you before, we do keep track of our positivity rate. So if you include all of our areas from the drive-through, the hospital, urgent care, and the mobile, we're at a 14% positive rate. And I mentioned before, we typically have the mobile go to areas that we consider as kind of hot spots. But if you would take that component out, we're at about 13.2% positive overall. We have 24 positive COVID patients in-house. 16 are from Lancaster County, 8 are from outside of our county. We have 3 patients pending their results in-house. 2 of those are from Lancaster County, 1 from outside. We have 8 patients that are on the ventilator that are COVID positive. Those 8 are in our ICU. We have 7 in our progressive care unit and 9 in our general care unit. And currently, to date, we don't have another destination for our mobile clinic, but we will continue to work with our health department as where to deploy that. And with that, we'll take any questions.
Much better. The only area of critical, categorized as critical at this point, is still disinfectant wipes. The blood supply has eased, and please check with the blood bank though to confirm. But I know that we were trying to set up some things internally for an employee blood drive, and the urgent call, the community responded as they are in so many ways these days, and it alleviated that. So at this time, there is not an internal blood drive for utilizing Bryan employees because of they stabilized the supply. I think it's what I tried to address in asking for your help in recognizing symptoms, Matt. I think our biggest concern right now is as we open up. again, and people not adhering to the things that we know can help. So, masking when you're in public is going to be really, really important. Distancing and staying diligent. I think we addressed it Monday and would again here. We completely understand why people gathered in such large ways over the past 8 days. Those certainly present a concern, as is the incremental opening up, which we are fully supportive of in a very safe way, but it creates a fair amount of anxiety. John, do you have anything to add on that? Okay. We can confirm that we are participating in that. And then there are some other things that our pharmacy has been working on that, are in conjunction with others, that are either continuing or have been discontinued as well. So I promise you, when we have information on any of these type of developments, we will, be more than happy to bring our pharmacy and clinical leadership to talk about it.